Okay, first you'll want to go to here. You'll want to go to healthcare.gov. This is no matter what state you live in. And we're going to be going over just one state. All states are pretty much similar. So you can just follow along with this one. I picked the state of New York because it has a very robust healthcare enrollment exchange. And they have a very good calculator for calculating your finances, things like that. Just wanted to use this one as a ballpark, but they're all pretty much similar. So what you would do is and then once you go to healthcare.gov, you would just pick your state. And then for some states, you will actually stay on healthcare.gov and enroll directly on healthcare.gov. But for other states, like New York has their own healthcare exchange. I think Pennsylvania has something called the Penny Health Exchange for Pennsylvania. I think California has their own health exchange. So you'll know whether you're supposed to go off of it or not. So what you would do is you would just, you go here. You want to sign up for healthcare, and then it says sign up for reminders, subscribe. So what you would do is you would pick your state, and we're going to pick the state of New York. And then you would just put in, an email address, so you could also do text messages too. What would you like to get updates about? Health insurance for individuals and families is what we're doing here today. Thanks, close. And so there's some things that you will need to sign up. And first and foremost, the database does close this Saturday night on January the 15th. So it is the website and the telephone is open all day, but you don't want to wait till the last minute. But if for some reason you can't get online, um, you can always call on the telephone, and if for some reason, they don't pick up, it might be very busy the last day, you can usually what they will say, it'll be an automated message that comes on and says, "Leave your number, we're busy, we'll call you back." Then they may call you back like 2 or 3 days later, and it will still hold your space in order to enroll, but only if you call on the 15th and only if they're busy. But I wouldn't let it get to that point because, they've done that in other years. I don't know if they'll do that this year, so you don't wanna, risk it. So I would just, just make sure you sign up on time. And, the enrollment process takes about, 2 hours to enroll online yourself, or if you do it with an enroller over the telephone, it takes about an hour and 15 minutes to an hour and a half, depending on your enroller and depending on what you have and what they have to ask you and how many people you have to add. If you have to add, a lot of children and maybe a spouse, might be, it might be the full amount of time. If it's a single person, might be a less amount of time. And, the one thing you wanna remember, whether you're rolling online, especially if you're on the phone, because you don't wanna be shuffling for papers while the person is waiting for you. The enrollment reps, are just, have been very friendly and very patient, but still you don't want to, spend too much time doing that. So the things you need to have are the W-2s for yourself and your spouse if applicable, and also the driver's license or state ID number for you and your spouse. And, people always forget to get their spouses and their children's Social Security numbers, so make sure you have their Social Security cards out and ready to give the Social Security numbers. And you do need the Social Security number to get the federal tax credits. It will help you, to pay for a large amount of your premiums, and you don't want to miss out on that. Sometimes they can search for you without your Social Security number by using your driver's license, but it just makes it more difficult. So I would just always say use your SSN. I don't know why some people don't use it, but there are people who don't because they always have that disclaimer there, and they've experienced people not having them or not using them for some reason. So, and what they will go by is you will have to it goes by your income and your marital status determine how much assistance you will get, for your credits. And, So it goes by if you are a W-2, you know, you have a traditional job where you work for someone else. If you are a W-2, it goes by your gross and not your net. Just always remember that. They're going by your gross before taxes, what they want to know what you make. You can, most states, you can subtract if you put money into your 401k. They're not going to include that as income for most states. But when you're on the website, you can click that little question mark button and it will show what your state considers income. Like click like when you see these little question mark things here, that's where you go to find out, you know, the questions for you know, your relevant state. So to be pretty self-explanatory of what you should show for your income. And also, if you're self-employed and you report it to the IRS, make sure you include this on your healthcare.gov or state application because whatever you put on your healthcare.gov has to match what you're reporting to the IRS. So that's what you want to do. And if you're self-employed, make sure you deduct for your expenses like you know, if you're self-employed and you use your computer at home, or you can deduct a percentage of the bill because you're using some of it probably for private use, like watching, you know, like surfing on web after you know, after you get off work. You can deduct a part of your car, a part of your phone bill, internet bill, etc. I'm sure you're familiar with all that. So just make sure if you're self-employed, you're going to use your after expenses but as your income. But if you're, you know, work for someone else, just going to use your gross. Okay, so what we're going to do is look into the enrollment healthcare exchange. This exchange was created under the Affordable Care Act. That's the official name. It's often known as Obamacare. So we're just going to get right into what it will look like here. Let me pull that up. Okay, so what you would usually do is you would usually just log in and go through each steps and put in your income, just like you would if you were signing up for a bank account. Very easy. But pretty much myself and everyone I've already helped is already registered. So we can't go back into the profiles and play with them because they lock once you apply. You can't just go back and, you know, so I'm going to show you an account that has already been set up. And what it will look like is right here, you'll see on the side, it'll say, it's going to ask you all these questions as you go through. It'll say, you know, basically it's your contact information is first, build households, how many people in your house, are you married or what? And what's it goes by your residence, where you live and not where you work. How many people are there? Do you have any existing health care coverage? Married, filing separately, or, you know, what is your tax filing status? Single? And income details. That's where it's gonna so it's just gonna go in that order, income summary. You can always save at the bottom. Other information, I don't even know what that is. It'll be there somewhere. Application summary, that'll be where they tell you if you're approved for a credit based on what you told them, then you can find a plan. So just basically, you know, going down this list right here. And the most important thing is, okay. All right, and the most important thing is this little question down here. It says, "Do you want help paying for healthcare coverage?" This is the one that a lot of people miss and they wonder why they don't get credits. It will be somewhere when you're applying for, on your state website. You always want to check yes, unless you just automatically know that you're in some very high tax bracket where you don't need it, or you can't, or you're not qualified for it. But it does not hurt to check. There's no penalty if you make too much money, you don't qualify. We'll let you know one way or the other. You might as well check it and get the benefits that you need. Might as well give it a try and see if you qualify. So always check that. You're familiar with all that. So just make sure if you're self-employed, you're going to use your after expenses, but as your income. But if you're, work for someone else, you're going to use your gross. Okay, so what we're going to do is look into the enrollment healthcare exchange. This exchange was created under the Affordable Care Act. That's the official name. It's often known as Obamacare. So we're just going to get right into what it will look like here. Let me pull that up for you. Okay, so what you would usually do is you would usually just log in and go through each steps and put in your income, just like you would if you were signing up for a bank account. Very easy. But pretty much myself and everyone I've already helped is already registered. So we can't go back into the profiles and play with them because they're locked once you apply. You can't just go back and, so I'm going to show you an account that has already been set up. And what it will look like is right here, you'll see on the side, it'll say, it's going to ask you all these questions as you go through. It'll say, basically, it's your contact information is first, build households, how many people in your house, are you married or what? And what's it goes by your residence, where you live and not where you work. How many people are there? Do you have any existing health care coverage? Married, filing separately, or, what is your tax filing status? Single? And income details. That's where it's going to. So it's just going to go in that order. Income summary. You can always save at the bottom. Other information. I don't even know what that is. It'll be there somewhere. Application summary. That'll be where they tell you if you're approved for a credit based on what you told them. Then you can find a plan. So just basically, you know, um, going down this list right here. And the most important thing is okay. All right. And the most important thing is this little question down here. It says, "Do you want help paying for healthcare coverage?" This is the one that a lot of people miss and they wonder why they don't get credits. It will be somewhere when you're applying for, on your state website. You always want to check yes, unless you just automatically know that you're in some very high tax bracket where you don't need it, or you can't, or you're not qualified for it. But it does not hurt to check. There's no penalty if you make too much money, you don't qualify. We'll let you know one way or the other. You might as well check it and get the benefits that you need. Might as well give it a try and see if you qualify. So always check that. Okay, and then a lot of states, and sometimes it's based on the city too, because sometimes like LA and Miami and New York City will do things that other places won't. But a lot of states, they base your qualification on, like I said, give me 1 second here. Okay, so it's based on this is like I said, this is an application, so some of it's blanked out because it has personal information on it, so that's why it's erased. But it's going to ask you if you're single, married, divorced, separated, widowed, your date of birth, social security number, and a lot of people who are, I think it's sometimes people who are permanent residents may only have a work social security number or something like that. But I think in most states they still give people who are not citizens. A lot of times they do get health insurance. I know some states do that. Okay, so this right here, if this is a New York example, if you participate in something like public assistance or EBT or any other type of a lot of public assistance program, they'll give you these cards. So they want to ask you for this number, the CIN number, if you have one of those cards, because it will help them look you up easier. You might qualify for other things or qualify for a different discount. I'm not too sure, but there's a benefit to putting that. If you get that program, you definitely want to put that in there. Okay. And also it helps you from getting enrolled in 2 programs and getting a penalty because you don't wanna be involved in Medicaid and also the state health exchange. Then you have 2 health insurance, and you don't need that. And they don't want you to do that because then they have to pay for 2 things. So, that is basically the program qualification page. You'll see that. And a lot of states don't have these 2 little, things on here, so not every state will have that. Just be aware of that. But they're all gonna have the date of birth and all that, things like that. So and then and this next screen it will go to, it goes to your, status. This will also help you qualify for different programs. It's basically, it's asking women if they are pregnant, yes or no, and, it's asking people if you, um, are American Indian or Alaska Native and you, like I think it's you have to live on a reservation or have, like, papers, like tribal papers. You can sign up for healthcare all year round, or you can stay on your own um, urban Indian health program or other services, Indian health services. And is this person blind? You want to answer that. You might get some extra benefits. Are they disabled or chronically ill? So those are basically the questions that they're going to be asking. And so now we're going to go over to the enrollment area. And so basically, this is what the enrollment area looks like after you've already enrolled. So basically, we're kind of already in it. And before you pick a plan, we're going to go over to picking plans now. So now you've signed up and you've answered all the questions about your private life. You put in your income, and now they want to know, um, you know, and it will tell you what you get approved for. Then it will say pick a plan, and the approval is just approval. Approval letter. That's it. We're actually going to go over that in the end because I want to go over how to pick a plan first. That's like the most important. So the first thing you want to do is you want to know the important definitions for a plan. So we'll go right over here. Okay, so what you'll want to do in order to pick a plan, there are metal categories, bronze, silver, gold, and platinum. And in some states they have a catastrophic plan. All right. And so, and what they mean is they start at bronze, silver, gold, platinum, goes in order of importance, just like the Olympics. And what it means is that it means how much percentage they will pay. The higher the plan, the more they will pay, and the less you will pay. So if you get down to the catastrophic plan area, you're going to be paying like only 50%, lower cost, but doesn't cover that much. And if you want to get the federal credits, you have to pick you have to pick a silver plan. That's where you get all the credits and the most money, most for your money. So bronze is for or catastrophic a lot of times is for people who may be like a lot of times younger students or single people who are on their own. Maybe they're really young, they'll get that. It's they feel like maybe they won't need it as much, or they're in a position in their life or the type of health where they won't go to the doctor that much. And then silver is pretty much the most common one. Gold and platinum is like, I know if you have a higher income, you can afford the platinum because, like, say, if you have a chronic disease, you're at the doctor all the time, you know, you need all types of healthcare and specialties and treatment. And you'd also have to have kind of have a higher income too to do the platinum because I don't think the government will assist with federal credits for that. But I'm not too sure. I have to check. I don't think they have federal credits for platinum, but I would have to look into that. I'm not too sure. But platinum and gold are very pricey plans, and, so it's kinda, for a little bit of a higher income level. So and this will help you determine which category. So bronze, they cover 60%, silver covers 70%, gold will pay 80% of your insurance bills, and platinum will pay 90%. And as you see, your cost decreases. It goes all the way you don't have to be it decreases all the way down to 10% whenever you're into platinum, but this is what you're gonna be. You're gonna pay 30% because I think that most people watching this video are going to want to get the federal credits and apply for silver. So let's go into detail. What metal category is right for you? Okay, so this is the New York, healthcare healthcare exchange, and I just picked, New York because they have a very good, like, robust exchange, and everything is, set up very nicely. Even when you first start, like, it'll say and most states will offer this. This is the New York, their own state of health. So if you go to healthcare.gov, if you and you click I live in the state of, New York or whatever state you live in, New York. Once you hit sign up, it will just lead you over to this. So that's what happens. Or if you live in Pennsylvania, it will lead you to Pennsylvania. So things like that. So, and they have an enrollment calculator where you can actually start to search and price out a plan without even signing up, without even putting in your name, just to play around and see what it's like and how much it will cost you. And so what you would do, at least for this state, some states you might have to sign up first. I don't know, but you can give it a try. Um, you go here and then you put in, I'm not, you just enter the zip code for wherever you're going. And be careful to enter the zip code where you live at because different regions and different counties have different prices for their plans. Um, Healthcare costs are based on, I think it's, I know it's zip code and, I don't know if it's age or something like that, but the average age of the people in that area, but yeah, that's what it's based on, just so you're aware of how the pricing works. So when you get into here, it's going to ask you, it also mentions the American Rescue Plan signed into law March 11th, 2021, lowers healthcare costs and has expanded financial assistance. And so you'll just start with these plans here. And there's actually less plans this year. There used to be like tons and tons of plans all over the place, but there's less. Plan year 2022, I'm just going to put in just for an individual person, just going to do like one person right now, just to get a gist of what it's like, what it costs for one person to insure themselves. I always do medical plus dental because why not? You can get all your medical and dental in one place. You can go out and buy your dental somewhere else. But to me, it's just great to have everything all in one bill, and there are a few dental plans that have, like, an in-network, affiliation where they have a bunch of, dentists that will work out payment plans with you, but overall, most dental plans are not that great anyway. They're kinda all the same. The first year, you cannot get, like, any major surgery, because if they did, everyone would just sign up for dental insurance. The first year they need help, get all their surgery, and then leave, and then dental plans would never make any money or be able to pay for anyone's, coverage. So you have to be in a dental plan for a certain, like, a year, like a 2 or 3 years before they cover anything major. Of course, they cover cleanings and a certain percentage of the, care, but not much your first year in it, and that's for all plans, not just, certain ones. Okay, and then metal level is silver because we wanna get the federal credits. And then, the good thing about this is it tells you other states may not do this, but it tells you how much help you get right up front. So we're gonna say this person lives in, let's just say they live in, I'm gonna actually see once. Okay, so let's just do this financial estimator number of members in your household, one. Number of adults needing coverage, one. Number of children, this person lives by themselves. No dependents yet. So we're just gonna put that they make $35,000. So I would say that would probably be the lowest for New York average full time if they're that would be in need of credits. One person. All right. And so then you just hit search. and it says, "This estimate of financial help disclaimer, if you make $35,000 and you live in, um, New York, this is an estimate of your financial help. Your actual advance premium tax credit will be determined at the time you apply for coverage." And this is pretty accurate. I've helped people apply before, and it's usually pretty much the same dollar amount. This is what I was talking about how it's very important to, um, know the difference between a a premium, a deductible, coinsurance, and copay. So what you're going to do is, I personally know people in Fidelis, they really love it. Metro Health, I haven't heard. Emblem seems all right. So you see, after they apply this tax credit, if you make 35,000 a year, they're going to help you pay $476 per month. Okay, because New York has a much higher cost of living. In most states, the health insurance plan is like a good health insurance plan is like 480, but in New York, it's like 660. So that's why it's a little bit more expensive. Well, New York City and the boroughs and Long Island, but the rest of the state is not that pricey to live there. Okay. All right. So you see this person who makes 35,000 a year, they're going to be paying between like 150, $200 for health insurance, and then the federal credits will pay the rest. And so we're just going to go and see what you get for this dollar amount. And I'm just going to go and compare Fidelis. I'm just go to the mid range, what you get for $184. Nah. Well, we'll do both. We'll do both. So what you would do is you want to compare them side by side. You go to the compare plans, and almost every state has this that I've worked with. As I work with people from a couple different states that I've helped online, and so you click the one you want. You can click up to three. I pick one, two, three, compare each plan, and then I hit compare plans. All right, and then this is what I was talking about. All right, there's going to be pluses and minuses to this. Fidelis always has the most. They do a lot for their clients. Let's just see. The one thing is no referrals. I've seen people just sit and wait for their doctor to give them a referral. They don't get it, and it's just a lot of hassle. You can just walk into any specialist you want. That's a great one of this plan. Trying to think if no referrals required for this one either. And pretty much all plans are covering mental health. That's really good. It's a lot of people are starting to get their mental health that they need. And I think looks like Health First is, and this is more, yeah, it says design. Okay. All right. So let's just talk about what I was talking about before. If you make 35,000 a year, you're going to pay 184 for Fidelis, 226 for Health First. Oh, it's a more pricier one. And then Emblem is 217. This is just one person, right? Okay. So look at the deductible. This deductible is very low. So once you've spent $1,300 in doctors and medical bills, um, then they will pay the rest. Um, you still do have to pay your copays. So just be aware of that. Hold on for a second. Yeah, so like you said, a co-payment is payment you make each time you get a medical service after reaching your deductible. So you still have to keep paying your deductible up to $8,500 per year. But the good thing is if you have a major surgery, you're only going to have to pay 8,500 of that. And trust me, when I say most surgeries are going to be, one surgery, even a fracture is $6,000, right? So, and even a major hospital to say is gonna be like 25,000, they're gonna get up into the 6 digits, it might get into the $300,000 range. You'd much rather be on the hook for 8,000 than 200,000, so just kinda think of it that way. And, this deductible is, in my opinion, too high for somebody who makes 35,000 a year. This might be okay, and this might be okay. So I would go for this. If I were making 35,000 a year looking at this, and out of pocket is kinda all in the same 6 to $8,000 range. Alright, so and you have to also think of, there can I afford to pay, 226 per month? For a lot of people, that's gonna be, a deal breaker between this and this. So they might pick the 184 'cause sometimes that extra, 40, $50 may be hard to come up with depending on the person and their situation and who they live with, etcetera. And so this is what we're looking for is the copay. Now the copay after emergency room is going to be pricey anyway, but the emergency room you can pay back over time. Your primary doctor and your specialist are the ones you're going to have to pay right away. So you want to know what you have to pay them. So outpatient surgery. So this is what you want to look at. Your primary care. What do you have to pay to visit your regular doctor, for sniffles for your children, things like that? $30 every time you go. And a specialist, $55. Now, if you're someone who gets an allergy shot every month or you see a specialist often, you need to consider that. Like, um, these are kind of similar. So this plan may be worth it because, let's see something for someone who makes 35,000. Let me see. 226 minus 184. But there's a $42 difference. If you're going to go to your specialist, like all the time, and maybe you have to go twice a month, it's going to get into 55 times 2 is going to get into the $110 range. So it's worth it to pay just the 42 to be able to go, as often. Um, Let me actually see. Oh no, it wouldn't make a difference because in this one they have to pay anyway. Yeah, it wouldn't make a difference. Yeah, for this plan. There are some plans that have 0 co-pays after deductible. Like look at this one, 217 a month. But after you reach your deductible of 6,000, you don't have to pay to go each time. Let me see. Oh, yes, you do. Yeah, you still have to pay. But look, this deductible is too high, I think, for this income level. So, but I mean, it's up to the person to decide. So, of what works best for your situation. Then you have mental health. Now, with mental health, this is very important. If that's basically all you're going for, you probably want to go to the no charge after deductible. But then again, the deductible is very high, so that's a hit or miss. Um, and I say that because mental health, inpatient. That's okay. Outpatient services. $35. Most people go to see a therapist every week. You usually don't just go once a month. I mean, so you're gonna have to pay just for your therapy alone, $140 if you go once a week, or $70 if you go, um, every 2 weeks. So if you're someone who's always in therapy, try and find something with, no copay. You see this? If offered in your state, but if you can't find it, then that's, but, that's one of the most important things. And there's other things you wanna look at, hospital. The one thing I like about this, emergency services, it's just, hospital and, the emergency room, a lot of times you have to pay a co-insurance, and that's not good because an emergency room visit can be very pricey. So I always try and find something that just says co-pay and not co-insurance for an emergency room. And then hospitalization is very important because you definitely don't wanna pay co-insurance for a hospital visit because that's like it can get very pricey. At least this is a flat rate of $1,500. Now this says copay after deductible. The deductible is only 1,300, not bad. So you're paying 1,300 plus, where'd that go? Where'd that go? Hospital. I lost it. Okay, yeah. This is the hospitalization area. You're paying 1,300 plus. let me see, 150. So, well, maternity is different. It's a little bit different. 1,600. So this says no charge after deductible, but guess what? The deductible is extremely high. So I don't really think that's the better plan. And that's what you want to look at. I think you want to look at if your teeth, your children may have like different dental work they have to get done. You probably want to look at that as well, and just compare. Like you know how often you go to the hospital, how often you might need, and that you can make that decision from there. And so let me pull up another screen here. Okay, so now I'm going to bring up a different screen. So now that you say, let's say you have picked your plan and you know what you want and let's look at just another plan here to see if we can find something a little bit better with, let's try actually a different county. Let's do, maybe there's like a cheaper county. We'll try like, well, that's Essex, is that Essex? We'll try Essex County and we'll try someone who makes 35,000 again. And we better try the same place because we want to keep it, um, let's see, we read New York. We want to keep it the same so we can have a good comparison. Okay. So then we're going to go back to, that's all they offered us. So let's see what these first three plans, what they offer us. Compare plans. So this is like you're getting coverage the federal government will pay 636, 629, and you will pay 160 a month for health insurance. This is 95 a month if you make 35,000 a year, and then the deductible is 4,450. That's like that's a really great plan. But let's see exactly what it covers. Okay, this is what I don't like when you have to pay the 40% coinsurance because the emergency room visit can be expensive. There's a reason why that's so cheap. Okay, so that's when you want to kind of look, and then hospitalization, coinsurance. I don't like that, but it's up to you if you like it. Prescription drugs, generic drugs will usually be $10, so make sure you look at that. Mental health, that 40% coinsurance, because a mental health visit they can charge, $200 for one visit. So you're going to be paying a lot more than 35, so you're going to be paying 80, with this plan. So your per visit is going to be more expensive with this $95 plan. That's why it's much cheaper. So let's go over to this and see. These are good deductibles, 3,500 for someone who makes 35,000 a year. Um, for let me see. So okay, and then the out of pocket, and they're kind of high for all of these, but okay, so we'll go down and see what they make you pay. So for your doctor visits, you're going to pay. Wait, I want to go to your regular doctor. Other services. Okay, so for your primary doctor, 40, that's normal, $30. Specialist visits, 60, and 50. That's why, because the specialist is more expensive. So, hopefully you only see your specialist maybe once or twice a year, but only you know that. So, like I said, an allergist is a specialist. Some people get an allergist shot every month. So think about that, when you get this type of plan, if you can afford it. But sometimes the best thing to do is don't buy a plan so expensive that you can't afford it at all and you get behind in your payments. It's better just to get the cheaper one because if you can't afford the plan, you can't afford the plan. You know what I mean? So you just got to get what you can afford in some cases. which will be, important when you're at an income level of that nature. At a higher income level, you don't have to make those sacrifices, but at a lower one, you do, especially if you're living in like an expensive place like New York. So let's go on. You might want to know what type of credit do I get and how much. So just give me a little break here. And it's been about an hour. Just give me a quick break, and we will get into the next area of what credits that you will be getting. Okay, so now we're going to get into how you get or how much credits you will get and how to get them. Okay, so basically your credits are based on your income and whether you are married. And let me just start by saying, if you're in the process of going through a divorce and you're not officially separated or divorced yet, they will still include your spouse's income. However, you have to check with your state. Some states, if you have been separated for 6 months, like officially separated, then you can go ahead and file your health insurance as a single person and get the full credit and not have to include your spouse's income. So that way you'll get more credit because they won't be helping you. Your spouse won't be helping you. So, but like I said, every state is different. Um, so just kind of look into what it is for your state. And so let's look at who gets help. And it tells you like family of four, family of five, family of six, family of seven. Um, If you're at the federal poverty level, 12,880, you see for individuals, then a standard family of 4, 26,500 is considered federal poverty level. And some states adjust for their state. Like I know New York and California, they pioneered helping their citizens way before the Affordable Care Act came along. They've always been a very much pro health care state. So they were kind of doing this before the Affordable Care Act. So, but the Affordable Care Act has been helpful for a lot of people. And I've even noticed that because people are getting so much preventative care, cancer rates have gone down in a lot of places. So it's really been helpful. And you can make up to 400% of the federal poverty line and still get help. Your help will be less because you make more. You get help and percentage of of your income. So like if you're single, you can make up to $51,000 and still get assistance, just less assistance. If you are a family of four, you can still make up to $106,000 and still get assistance, just less assistance. So there's help for, up until the point where you probably wouldn't need it because you make enough money. So, all right. And you saw how we had the credit calculator earlier to calculate how much credit you will get. But let's say that you don't there's no, um, healthcare calculator. Let's just say there's no healthcare calculator on your state's website, and I don't think New York is so different that I don't think it would help to even use theirs, but, I mean, you never know. But, there is, like, kind of a general amount of what each state will pay. Let me actually show you this. At the end of the day, most states, like I said, every state's a little bit different. you're only going to have to spend 4.5% of your annual income to get a fairly decent medical plan. You're not going to get the gold or the platinum, but you'll at least be able to get like a relatively decent silver plan. This is assuming that you use, hold on. This is assuming that you use your credits. This is for people who've applied for their credits. So let's see, if you make 45,000 a year, um, your credits will let's see, if you make 45,000 a year, your credits will be enough that you only have to spend 4.5% of your annual income on your medical. This is just your premiums only, not anything else or copays, just your premiums, your monthly premium. So 4.5% of someone who makes $45,000 gross, okay? That is 2,125 that they'll have to spend themselves per year. So out of divide that by 12 months, they'll be paying about $169 for their premium per month if they make 45,000. And the rest of the premium, which will be like probably $400, will be paid for by the credit. So the credit is pretty good. Here it is. Okay, so we were in New York State of Health, and we saw that at first you could compare the plans and the estimate cost. You can also look and see if your health and if your doctor takes this health insurance plan that you might be considering. And some states have it all on one page. New York separates theirs, but you should it should be easy to find in there. And then what you do is what I was just talking about is you can search by your health insurance company, and you can also look up your doctor and actually see what plans they take instead of, doing the reverse and trying to look through every plan and find your doctor. Just put in your doctor's name and see if they accept the one you put. You just put in all your doctor's names there. And then for a facility, you might go to, a certain urgent care you like, a certain radiology practice you like. You want to know if it's covered in your insurance plan, whatever doctor is most important to you. You want to make sure that, at least it covers the doctors that are most important to your healthcare plan. Because sometimes you may not find a plan that covers every single doctor you have. You never know. I haven't had a problem with it, no matter what states I've looked at. It's been pretty good. So most doctors accept like a lot of plans. So hopefully it won't be that much of a problem. I know it can be. I've seen people switch all the time, but I hope that it will go well for you. And there's also a prescription search. When you log in, you can do a prescription search. I'm not logged in because, like I said, I've already signed up for another plan, so with something else. So I can't log into my account because it's locked. But you can, if you have if you have a common diabetic medication or other type of, maybe it's prescription ibuprofen or whatever, you can put it in and see if your plan covers it. And you might say, well, don't all insurance companies cover all um, medications? Usually they do, but there's also, if you have sometimes you have like a rare illness, you take a rare medication, some companies may not cover it. I don't know. So if you take something that's very unique, you have a hard time finding coverage for, you might want to research if that plan takes your prescription. And most generic prescriptions, I would say, with all the states I've looked at, are usually like $10 for a generic prescription. That's what basic. I don't really know if it's with like if it's a specialist type of prescription might be different, but that's what I've seen so far. Okay, and we're about to close out here. And before we do, just hoping you could please hit the subscribe button to heavily benefit the channel. It's free and it's kind, and it would greatly help me out if you got some information from this today. And you could also hit the PayPal donate button on the channel banner or the link below if you got some information from this presentation, just to help out your fellow YouTuber. And we're just going to get into our closing area. So we've got about 10 minutes left. We're going to meet our 1 hour and 30-minute mark, and I can take any questions at the end. And also, you could, feel free to put some in the comment section. I will always be looking at these and responding to these and getting back to you. So, if you're watching this, post live stream, and the question that some people might have is, um, you can go ahead and sign up for insurance even if you haven't filed your taxes yet, because your taxes have to match what you're putting on your healthcare application. But the question is, what if I haven't filed my taxes yet? It's January. Some people haven't sent their W-2s. So how do I know, what I am supposed to make? And throughout the year, like let's say you file your taxes in March and you're self-employed and you realize you had way more business expenses than you thought you would, or maybe you had way less. If you're self-employed or just for whatever reason you realize your income is different, um, upon discovery, once you do your taxes or whatever, or you just have to call the state of health, and I'll put the number up at the end and just redo the application, or you can enroll online and re-input the application, and you would just go and click, say, I want to update it. There's a section to update it in the enrollment area. And you will submit that. They will review it. They might ask you for new pay stubs, and your credits may increase because you had less money and maybe your business, lost money, so therefore you get more credits, or you may actually owe them and have to pay back some credits, but that's only because you made more money, so you have to pay it back. So just, they're gonna see your IRS, papers anyway, so you might as well just go ahead and do it. And you are required to report changes within 30 days. So do that, but you can still apply for, enroll regardless, because the deadline is January 15th. You got to get um, your application in. And once you once you get approved for the credits, it will then go over and say, pick a plan. Sometimes it will say you have 30 days to pick a plan, depending on the state, and we will hold your application until then. But if you want coverage right away, you got to pick fast. So it's up to you when you want coverage. But like usually, if you pick in November, your coverage starts in December. If you pick your plan in December, your coverage starts in January. If you pick your coverage in January, it starts February 1st. So those of you who pick today will get your coverage starting by February 1st. Okay, so and when you get approved, um, it will look like this. Let me find it. When you get approved, you get a letter that looks like this, and it's blurred out because it's actual a personal letter that someone received, and I want their information to show. So it basically says, we made a decision on your application that you put in, dated November, and notice it says coverage starts December. So it always starts the next month. And it tells you what plan you got, how much you pay per month, um, the type of plan, co-pays, and it also says, enroll in dental or vision. I always enroll in dental and vision I don't want to shop around for different plans. I just want to get it all in one shot here. Um, when the eligibility is effective, it also says, go ahead and pick a plan. When you do it online, it will send you to a page where you have an inbox. It'll have all these little letters in there. You can download them into your computer or on your phone and read them. And that's when you would get this letter, is right after you get your dollar amount that you're approved for. And then we did already pick a plan, but this would actually come before that. This letter comes before what we just did. And sometimes it won't say that. It'll say upload documents. Then we'll make up our mind. But I think even while you're uploading documents, you can still pick a plan in most states. They will give you step-by-step instructions on what to do. So check your inbox in your exchange for your state on the next steps to take. It'll always be in there. And a unique part of the Affordable Care Act, If you get if you're there is a 3-month grace period, you can, if you're late, you could be late up to 3 months on your premium payments. I wouldn't stretch it out that far, but if you need it, it's there. This is only for people who get federal credits. No matter how many credits you get, it applies to you. And, but the thing is, you can't use your coverage if you're more than 30 days late. What they will do is they will suspend your coverage, but they will not terminate it. And it's up to the doctor whether he or she wants to accept suspended coverage or not. Most doctors won't, but some doctors will. Large practices usually will accept it because they can have so many patients that can spread their income over, but a small practice usually won't accept a suspended, insurance. They want you to make sure it's active. However, if say you go to a doctor's office, you find out it's suspended and you hurry up and pay it, usually the health insurance um, company can give you a code, give your doctor to prove that you just paid it and you don't have to miss your appointment for that day. So just keep that in mind. And but if you're not on federal credits, if you're not approved for credits, you only have a 30-day grace period, so keep that in mind. You don't get the 3-month grace period, so just be aware of that because people who don't qualify for credits tend to have very high incomes. They don't have to worry about, being more than 30 days late anyway. And you may ask, is there a penalty? A federal penalty like there was, it was back in 2019, maybe, or 2018, for not paying or not buying insurance. Do you have to buy insurance? The answer is not on a federal level, no. But there are a few states who still require it. So there's 4 states plus the District of Columbia who require their residents to buy insurance. That would be the District of Columbia. You still have to buy insurance or pay a penalty. Massachusetts, New Jersey, Rhode Island, and California. But again, California has always been good with insurance. It's because they offer so many benefits to their residents that it's really worth it. But so if you're in Massachusetts, New Jersey, Rhode Island, California, your state still doesn't have a penalty. So just keep that in mind if you live in those states. If you don't live in those states, you don't have to buy insurance if you do not want to, but I don't know why you wouldn't. It's such a valuable thing to have. And you're just going to end up owing, a lot of back payments to the doctors and hospitals and things like that. And the one thing is, you may have already signed up for health insurance. Even if you have, health insurance did go up this year for obvious reasons. There's been a lot of people have needed, excessive health care the last 2 years. And healthcare goes up in general, it doesn't go down anyway. So keep in mind that, is a little bit more pricier this year. And so you might want to log in and get a cheaper plan because what the health insurance market does is it automatically re-enrolls you every year. If you click the button that says you give them a 5-year access to your tax returns, there's a button for that at the end. But even if they automatically re-enroll you, you can still downgrade to a cheaper plan if your income has changed. So you don't want to miss that opportunity. The opportunity is until January the 15th. And you can still go in and just downgrade. Um, Also, many states have completely free um, income, has completely free medical insurance if you are of a certain low income. It's called Medicaid. And so a lot of states do have completely free medical care where there's zero coverage. It's called Medicaid. And please not confuse it with Medicare. Medicare is for an entitlement for senior citizens who are 65 in this country. Might be 67, 60, 67 or something like that. But and then Medicaid is for people who are low income or people who are disabled. And so you may qualify for it. I don't think anybody full-time qualifies for it unless you're, like, qualified, like if you work full-time, but you're self-employed, you may not be making a full-time salary. So in that case, you would qualify for Medicaid possibly. Like if you're a new business owner, you're working 40 hours, but you're not making a lot of money. So you want to click the button for Medicaid if you think you apply. There's no penalty for trying to see if you qualify for Medicaid, so you might as well click the button if you think you do. If you click the button, they will do research. Sometimes you'll get rejected right away based on your income alone. If you get approved for Medicaid, you will get like a call or a letter in the mail within like 5 to 7 business days. If you live in like a smaller town, if you live in like a big city, they usually just send it to you in the mail. Like it might take 2 to 3 weeks if you live in like Miami, LA, New York, really big cities, because they have more people to serve. So be on the lookout for that letter if you get approved for Medicaid because you don't want to miss that deadline. Sometimes they call you on the phone. I know smaller towns tend to call people on the phone, but you never know what they're going to do. So just be on the lookout for that. And then you don't have to pay. You get totally free, healthcare, period. And if you get approved for Medicaid, you will enroll through the main market, but you'll be transferred over to your county. And so you'll get a Medicaid card plus a health insurance card. So the Medicaid card will be your payer. The health insurance card will be who provides it for you. So you will have two cards if you're on Medicaid. Just be aware of that. And a note for people who are victims of domestic violence, if you like, let's say you are married, most states require you to report your spouse's income. However, depending on the state, look at your state laws. It should be in your state's database in the enrollment area for health insurance. Um, if you are still married, but you know you will be divorced by the end of the year, like December 31st, you can um, get health care at the single rate and still get all your credits and not have to use your spouse's income. So, like I said, check with your state and see what their specific rules are. So that really helps people who are victims of domestic violence and they're married but they're not getting any support from their spouse at all. So they're living like a single person. So, and if you want to call the healthcare line, it's open 24 hours a day, but don't wait till the last minute. And the number is, actually, I didn't put the number up there. So the number is, I will put it down below in the comments because I don't have it up here on the screen. The number is 1-800-318-2596. And for TTY service, you would use 855-889-4325. And that would pretty much cover everything. And we definitely hope that you have learned something from here. We are still active below in the comment section. You can feel free to ask any questions that you would like. And we really do appreciate you stopping by. And please look through the rest of my channel. We're going to have other like health related and healthy lifestyle related things going on this channel. So you can feel free to check that out, other things as well. And we appreciate you stopping by. And we hope you enjoy the rest of your day.